And so that brings us to the special of the day. And today we are going to do a little special, different special, in the sense that I've received this question on how to use inositol for anxiety. And so we are going to address that question today. So recently, this friend of mine, she asked me if there is a natural way she can deal with her anxiety. Now, a lot of people who have severe anxiety, they end up seeing a psychiatrist or psychologist. But people who have, like, mild to moderate anxiety, they are functioning, they don't want to go to see a psychologist, a psychiatrist or a psychologist, but they want to take some steps to get better. So they are kind of interested in some natural remedies. So my friend, she's functional, she otherwise does well, but this mild to moderate anxiety prevents her from being her best. So she's always anxious inside before the performance, at work presentations, when she's going to places, and she's always worried inside. It is preventing her from living her best life. So I gave her some certain suggestions. And so one of the suggestions was using inositol in addition to L-theanine. And so she asked me how to use it. And so I shared with her how I share with my patients, and what helps people. So would you like me to share with you?
Mm-hmm.
If you are having anxiety, so let me just first define what anxiety is. Anxiety is feeling of a nervousness, that uneasy tension, body becomes tight or muscles become tight, or you're having palpitations. Some people have panic attacks. Some people start worrying too much. And so there's this continuum of anxiety. When it becomes like mild anxiety is normal. Okay, so before an interview, before we start this program, I have mild anxiety, right? So that is normal, because then it prepares you to perform the best. But when the anxiety increases to the point where it starts affecting your functioning, it becomes dysfunctional anxiety. That's when it becomes a problem. So then we call it anxiety disorder. All right, so, and it's different from stress, because stress is kind of stress reaction, and it also has some similarity with anxiety, but there is a difference in severity and presentation. So there are many ways to deal with anxiety. Of course, very, very severe anxiety, we have medications, but for mild to moderate anxiety, we can address it at three different levels. One is mind, body, and lifestyle. Okay. So we don't have time to go into the detail of everything. And in this series, I'm covering different techniques that people can use. So today I'm going to focus on just one of those, which is a green pharmacy, or a natural supplement that you can use to decrease your anxiety, called inositol. And so inositol is one of the very commonly used, very effective tool for anxiety from the body perspective. So the question is, how does it help? So it decreases the body's reactivity, which people feel in terms of body anxiety, when heart is beating too fast, or your body is tense, or you're getting the panic attack. How to use it? So it is available in many different forms. The capsules, the tablets, the powder. The best form that I recommend to people is in powder form. So you can get the powder, and then every morning in a glass of 8 ounce, you can put the small amount of inositol. You start with 3 grams a day. 3 grams is maybe quarter of a teaspoon. Look at the measure on the bottle. And so you start with the 3 grams in a glass of water in the morning, or sip it through the day. And after 1 week, you can go to 4 grams. And after 1 week, you can go to 5 grams. So maximum, I recommend to go up to 10 grams, or the dose which starts giving you diarrhea. So let's say if you start having diarrhea at 9 grams, then stay on 8 grams. Take that powder in the water every morning. And what patients tell me that their overall anxiety has gone down, the number of panic attacks have gone down, and they are tolerating pretty well, except the diarrhea at the higher dose. Most people tolerate it pretty well. People have shown to have some mood stabilization, so their mood is not fluctuating as much and they feel calmer. The second question that comes up is like how long to take it and when to stop. And so any of these things, you want to try it only maybe 3 months at a time. It is a very tolerable medication, so if needed be, it can be continued, but I advise people to try it for 3 months, develop your mind techniques and lifestyle changes so that your anxiety goes down, and then you can try to go off, and if you're able to go off, then you go off. The second question is like, can you combine it with other medication? Yes, if you're taking medication for anxiety, you can combine it. We frequently combine it with L-theanine, which is another herb that we use. Not herb, but it's an amino acid that we use that could be combined together. So you can use the inositol on a regular basis and then L-theanine as needed. And then when to seek treatment. So know that these treatment recommendations are only for mild to moderate anxiety. So if you are having continuous anxiety, if the treatment is not working, if you are having side effect, it's very important to seek treatment. And you want to seek treatment from either an integrative psychiatrist like me or a naturopath who can explain to you use of natural remedies if that's what direction you want to go. But you don't want to just continue to suffer yourself. There's a lot of help available. Where to order? So it is available at many stores. One of the problems happening with the green pharmacy is because there's so many companies producing so many types and there's no FDA oversight. We don't know what people are getting in the general retail store. So there are third-party tested practitioner level pharmacies that doctors partner with. So I can add the link in the description where people can order from one of the third-party pharmacy that you can get the products kind of more reliable because that has been tested by the third party. I hope this information helps people out there who have anxiety. And if you have any further questions, please send us those questions and we'll try to answer in these programs. But just remember, these are not treatment recommendations. These are just suggestions, and always seek out your healthcare professional for specific treatment advice. Thank you so much for your time, Annie. Thank you for joining us today. Let me leave people with this question, what you also posed, that today is the first day of the rest of your life, and you have a choice. What are you going to choose? Are you going to continue to suffer for whatever reason or thoughts that have been making you suffer, or you're going to take steps, learn some new tools, and improve your mental health and well-being and live your best life? Remember, every day is a new day, new opportunity to make new choices. Keep making new choices. Stay safe and healthy. Till next time, Dr. Rozina.